afternoon. I am so delighted to be here with the women of the House. And some very good congressmen as well. Thank you. Thank you. We thank you all for joining us today, especially our special guests, because once again, Republicans are playing political games with the health and financial security of the American people. And once again, they are stealing from the working class to give to the billionaire class. And once again, it is women and families who are paying the heaviest price. The same right-wingers who lecture women about having more babies in the same breath are saying, but let's kick millions of women off of their health insurance. Let's defund women's health clinics. Let's cut Medicaid by $1 trillion. $1 trillion. And let's be very clear about who they are taking that money from. 40% of all births in this country are paid for by Medicaid. 40% of our kids are covered by Medicaid. And among the lowest income families, families living under the poverty line, 80% of our kids are covered by Medicaid. And think about what it means to live under the poverty line. A single mom and one child, that means surviving on less than $22,000 a year. That's who they want to go after? That's who has it too good in this country? That's who needs to sacrifice more and get by with less. How morally bankrupt do you have to be to say with a straight face that a child should not be able to go to a doctor because Elon Musk wants to be a trillionaire? The Democratic women of the House are gathered here today because working families deserve better than this Republican budget. They deserve better than this Republican healthcare crisis. They deserve better than a Republican Congress that prioritizes billionaires' wealth over families' well-being. They are going to fight for the better future that they deserve. And the better future we know is possible. And I am so proud to be in this fight alongside my colleagues here today and some incredible advocates that are joining us. And along with our special guests, we are going to hear from three indispensable leaders here in the House. The chair of the Democratic Women's Caucus, Teresa Fernandez. The chair of the Congressional Asian Pacific American Caucus, Grace Meng. Hey, Grace. And the chair of the Congressional Black Caucus, my cousin, Yvette Clark. But first, we are going to hear from a medical professional who is also a mom. So welcome, Dr. Tamara Blackwood.
Hi, good afternoon. My name is Dr. Tamara Gail Blackwood, and I'm a pediatrician right here in DC. Every day, I take care of children and families who depend on Medicaid to keep their children healthy and safe. A few weeks ago, I saw a little boy, and his family had a lapse in their Medicaid coverage. During that time, the family had to decide between keeping their lights on and paying for their child's controller medication. That ended up, for him, he ended up in our emergency room. He had a prolonged ICU stay, and he almost did not make it. Medicaid is not a luxury. It is a lifeline. It is keeping our children in not only our local community, but our national community alive. For some of my teenage patients, the mental health care access that Medicaid affords could be the difference between life and death. Medicaid keeps our children healthy. As Representative Clark was telling us, Medicaid pays for over 24 million births in this country. That means when I see patients and they're healthy, so many times it's because their mothers had access to the prenatal care that Medicaid affords. Medicaid not only keeps our kids healthy before they're born, but when they're right in front of us here too. We need to choose our children, and that means keeping Medicaid intact and our premiums low. I'd like to yield to Representative Ligia Fernandez.
Thank you. Thank you. And each of the stories that we're hearing today are going to be echoed across every community in America. Each of the stories is heartbreaking and unique, but it is nevertheless reflecting stories that could be told in millions of households. So I want to thank you, Democratic Whip Chair Clark, for bringing these stories to DC today for us all to hear. And we know that a government shutdown will hurt women the hardest. Women are the majority of the federal workplace. But we also know that women are the ones who are worried about taking care of their families, making sure that their families are healthy, who are having those babies, who are standing up and being there when there is an emergency. And women do not abandon their families during an emergency. But today we know that Republicans have abandoned America during this emergency health care crisis. Because what is the question we should be asking, not is who to blame for the shutdown, is what are the consequences? That's the question. Who will be harmed if we don't stand up for America's health care? And that's why it's so important to hear the stories of not just the doctors, but of the mothers who are doing everything they can to keep their children healthy. Yes, I am Teresa Ligia Fernandez, and I am very proud today to introduce another Teresa, Teresa Loney, a mother raising twin boys. I am also the mother of twins, Teresa. So you and I share a lot in common, and we are in this fight together. Please join me.
Thank you. My name is Teresa Loney, and I'm the single mother of twin boys, Dylan and Max, who are both profoundly autistic. Dylan is nonverbal, but deeply empathetic. His smile can brighten the hardest of days, and he loves to help with chores, especially gardening and landscaping. Max is pre-verbal, but he's already taught himself how to read, solve math problems, and master technologies in ways that constantly surprise me. In fact, let me share a story that always makes me laugh. One day, Max hacked into his program security system so that he could play fart noises over the intercom for the whole building. It caused a lot of panic when they were trying to figure out who was watching the cameras. And I was pretty scared that he was able to hack into something like that. But it also reminded me that my boys aren't defined by their challenges. They're full of light, mischief, and possibility, just like any other kids. But here's the reality. Because of their profound needs, it has fallen on me as their mother to provide round-the-clock care. Like so many women, I had to step away from my career. I spent decades as a retail operations manager. I was proud of that career. It gave me stability and independence. But when my boys needed more, I left. Not only that job, but over the past 2 years, 6 part-time retail jobs that I had to choose to either stay at work or leave and take care of my children. And a mother will always choose her children. That choice has meant living in poverty. It has meant putting my own stability and career aside, and it has meant relying on Medicaid. Not because I want to, but because without Medicaid, my children's therapies, their medical care, and even the chance for them to thrive would be impossible. So when we talk about cuts to Medicaid, I need you to hear this. We're not talking about numbers on a page. We're talking about my children losing their lifelines. We're talking about kids like Max, whose talents could one day make him a computer genius, or maybe just the world's best prankster, never getting the support he needs to reach his potential. We're talking about kids like Dylan, whose empathy and joy could change the lives of everyone around him, being denied the chance to shine. And as women, as mothers, we know who carries this burden. It's us. It is the mothers who step out of the workforce, who live in poverty, who shoulder the invisible labor of caregiving, only to have the government threaten to take away the one thing that keeps our families afloat. No mother should have to sacrifice everything, her income, her career, her stability, only to be told that her children's lifelines are too expensive. Yet that's exactly what these cuts would do. I believe with all of my heart that every person has a gift to give the world if they're given the chance and the support. Medicaid is what gives my children that chance. Taken away won't just devastate my family, it will devastate futures that deserve to be built. Thank you.
Thank you so much, Teresa. And now we'll hear from Representative Grace Meng.
Good afternoon, everyone. There's a trend here. Hi, I'm Congresswoman Grace Meng from Queens, New York, and I just want to thank our outstanding Democratic Whip, Catherine Clark, for bringing us together this afternoon. Thank you, Catherine, for always making sure that we prioritize our children and our families. As the mom of 2 boys, as you know, I know firsthand how vital it is for women and families to have access to the health care that they need. But the recent Medicaid cuts made by Republicans and their refusal to extend tax credits for health care premiums are unacceptable. These attacks on our health care system need to end, and I will keep up the fight to protect our health care and lower costs. I'm so proud today to introduce Laura Packard, a stage 4 cancer survivor. The Affordable Care Act helped to save her life, but the day after her first chemotherapy session, the Republican House voted to dismantle the ACA. Fortunately, this repeal did not happen, and she will now talk about how she would be hit hard if her health care is impacted.
Hi everybody, my name is Laura Packard. I'm a small business owner in Alexandria, Virginia, and like she said, I'm here because the Affordable Care Act saved my life. 8 years ago, I walked into a doctor's office with a nagging cough and walked out with a stage 4 cancer diagnosis. Thankfully, I had good insurance through the Affordable Care Act, which paid for the 6 months of chemotherapy and month of radiation treatments it took for me to be here in remission today. I am so grateful to the Affordable Care Act for me being here, being alive. But what I am not grateful for was that Republicans have threatened that health care. They did it 8 years ago, and they're doing it again today. Millions of Americans rely on their insurance through the Affordable Care Act, and many of us are going to be priced out. I dread checking the mail right now because any day now I'm going to get a letter from my insurance company with my premiums for next year. Whatever they charge me, I have to pay it. As a cancer survivor, I can't go without health insurance, and if they do not renew the subsidies, I will not qualify for help next year. So that means whatever they charge, I have to somehow figure out how to pay for it. Too many Americans are facing this same situation, and we need to protect our care and make sure everyone gets the health care they need and deserve. Thank you. I yield my time to Representative Clark.
Thank you so much, Laura. We are so glad that you are here. Thank you for speaking up about the ACA and what it means to women across this country. Next, we are going to hear from Philippa Pham Hughes. Please join us. Thank you for being here.
Thank you. In 2013, I was diagnosed with breast cancer, and the entire treatment would have cost $150,000, but I paid $3,000, and that's because I had health insurance through the Affordable Care Act. And as a freelance artist and writer, I didn't have coverage through work, and I still don't. And it was this, and I paid for this insurance out of my own pocket. And you know, at the time, I think it was around like a little less than $400, and that was like a lot of money for me as an artist. But I kept paying it because it was the responsible thing to do. And having this health insurance meant that I could get regular checkups, I could go see specialists, I could get the test, and it was those tests and those visits to the doctor that meant that I got to have early detection, which meant that the cancer that I had was actually quite treatable. So that's why I'm here as well to talk to you today. It's also meant regular follow-ups so that I can keep talking to you. So my premium has risen every single year since then. Right now, it's about $1,100 per month. And that's a lot of money for a freelance artist, but I'm able to pay for health insurance. I can continue to pay for health insurance because of the tax credits. Right now, I pay about $700. It's still pretty high, but it feels necessary. Given my past experience, it feels necessary to protect my health. So last month, I got this email from the DC Health Insurance Marketplace, and it said that the tax credits are ending, and I freaked out because basically once the tax credit goes away, it's going to double what I have to pay every month, and that means about 20% of my income, and that I just don't even know how to afford 20% of my income. It's always been a priority for me. It's meant, even when it's meant making a sacrifice, it means the visits and the tests that mean early detection for diseases that can be cured. It means that I don't have to forego life-saving treatment just because I can't afford it. It means I'm not going to lose my home because of really big medical bills. So I'm one of those people who's like just above the 400% of the poverty line that's really going to be affected by this. The poverty line for a single person like me is a little over $15,000. And as a middle class person, that puts me in a middle class. And as a middle class person, I'm going to be hurt most by this legislation, or among the many people who are going to be hurt most by this legislation. And that's who Republicans are going to take the health care from, people like me. And without this tax credit, I just don't know how I'm going to be able to afford the insurance that once saved my life. As a freelancer, I work way more than 40 hours a week. I don't know if any of you all know what that's like, but it's a lot. And it's not like I can take another job on at this point. And so I'm pretty outraged that Republicans have voted to drive up my healthcare costs, and it's all to give tax cuts to their billionaire buddies. They don't need the money. And so everything already costs too much. Everything keeps costing more and more every day, every week. And Trump and the Republicans are simply making it worse. So I am urging policymakers to not compromise on any cuts in our health care, the tax credit, and any coverage anytime ever from now until forever, because we can't compromise on this for any of us, for middle-class Americans like me. Thank you so much.
We want to thank Philippa Hughes for sharing her lived experience. This is what Americans are facing each and every day, and that's why we're in this fight. Greetings and good afternoon, everyone. I'm Congresswoman Yvette D. Clarke, Chairwoman of the Congressional Black Caucus, and more importantly, representative of New York's 9th Congressional District. Let me thank our Democratic Whip, Catherine Clark, I call her cousin, and our fellow House Democratic women leaders for taking this important stand today. And thank you to all of our speakers for bravely sharing their lived experiences with us and with our nation. As you've already heard from our speakers there is a human impact to governmental shutdowns. Just as there's a human impact to the GOP's crusade to cut Americans' health care. And that, unfortunately, is by design. In the face of the devastating cuts, these devastating cuts will create, Democrats are here to say, we will continue to fight for the women, children, and families who most need fighters in this moment. We will fight. We will fight. We will fight. We will fight. No matter what Donald Trump and Mike Johnson might want, we're not going to yield an inch to their cruelty. We will fight. Not today will we yield, not tomorrow will we yield, never will we yield. The American people deserve better, and Democratic women are here to say, we will fight. With that, I'm yielding back to our Democratic whip.
Thank you all. You have heard it from people who are impacted the most, and I am so grateful to each of you for coming and sharing your story, and so grateful to my colleagues who understand what this fight is about. People don't have freedom, they don't have security if they cannot afford and find health care when they need it and when their family needs it. That is what this is about. We implore our Republican colleagues to come to the table. When they are saying they won't be here or they won't meet with us, they're saying they're not here for who they represent. They're saying they won't talk with the American people at this crucial moment when they are fighting for their health care. That is what is at stake. And we are going to remain here with all of you. And we wish all of you the very best. And we are going to fight for all of the women and families out there who just want to be able to access the health care that they need. So thank you all again. And with that, we'll open it up to a few questions. We've answered them all. Again, thanks to my colleagues and thanks to our speakers.